All right. Good morning, everybody.
Morning.
Morning. We're all set up almost. Just waiting for. Cool. Well, I might just get started on the education side of things, and then we can just jump straight into it. So we're continuing on with cardiovascular health. So has anyone got any questions from any previous sessions since I last saw you guys? No? Okay. So basically, we're just going to go through a few different cardiovascular conditions, also known as cardiovascular disease. It's like an umbrella term for a couple of different conditions. So basically, just an overview of cardiovascular disease. It affects 4 million Australians, more than 4 million Australians. So that causes 1 in 4 deaths. It can cost the Australian economy about $5 billion each year, more than any other disease. Over the last 10 years, deaths have been declining thanks to research into risk factors, medications, and interventions. Aboriginal and Torres Strait Islanders die from cardiovascular disease at a higher rate than non-Indigenous Australians. It also kills around 40% more males than females, and lastly, kills 118 people every day, or 1 person every 12 minutes. So as you can see from those few little facts, it's quite prevalent. It's very common in a lot of people, and that's why it's important that we work on our cardiovascular health to try and reduce any risk factors and kind of mitigate any risks that we can there. So yeah, as I said before, it's an umbrella term given to several conditions that affect the heart and blood vessels. And there's 3 main types. So the first one being coronary heart or artery disease, which is the reduction or obstruction of blood flow to the heart, which can lead to a couple of different little things too. So one being angina, restricted blood flow causing chest pain. Myocardial infarction or heart attack, so complete obstruction of blood flow in one of the heart's blood vessels, causing damage to a part of the heart, and heart failure, where the heart is unable to pump the blood to the body properly. Another one of those main types is then stroke. So this is where there is impaired or lack of blood flow to an area of the brain, causing death to brain tissue. This can cause brain damage or even death. And there's 2 types of stroke. So the first one being ischemic, so obstruction of blood flow, or hemorrhagic, which is the plaque pierces the artery wall, causing it to bleed into the brain tissue. And then there's stroke versus TIA. So stroke is where the blood supply is completely cut off, whereas transient ischemic attack, or TIA, is where the blood supply is only temporarily disrupted. Does anyone know anyone who's had a stroke?
Yes.
Yeah.
Oh yes, we do, yeah.
Yeah. So it can kind of affect people differently, as you probably know through the people you know, but some people can come out a bit more severe and some people might not. So it all just depends on how long that disruption of blood flow has kind of lasted for. So does anyone know the FAST acronym when coming to identify a heart attack?
Oh gosh.
Forgotten it.
That's okay.
We're a first aider.
So
Used to be a first aider, but I've forgotten.
have you heard of the FAST acronym though?
Yes.
Yeah. So FAST, so F standing for face. So watching their face first and making sure if you can't, or to see if there's any drooping on one side, if they're able to smile or not, and maybe their eye or mouth has dropped as well. So if that's face, can anyone think of what A is?
Ask.
Oh.
Or arm.
Yeah. So then look at their arms. So are they able to lift both arms? Is there a discrepancy or weakness or numbness on one arm or hand over the other? So then you can kind of figure out what side it's affecting. And then S.
Speech.
Speech, yeah, perfect. So just getting them to talk, is it kind of slurry or like not clear? Are they even able to talk at all, or if they're not making sense? So just trying to get all those different things out of it. And can anyone guess what T stands for? No, so it's the time. So that's what I said before, that people's, I suppose, lasting effects can be different based on the time. So obviously, the faster we can get them to help, the faster they can get treatment, hopefully the less severe the outcome is. So making sure that you call 000 immediately, the faster they receive the medical attention, the better their prognosis. Cool. So then the last the last cardiovascular disease is peripheral vascular disease, or PVD. So that's the blockage in the blood supply to the arteries to the limbs. So particularly happens in legs. And the symptoms are usually pain, so a dull or cramping pain that is worse when walking and gets better with rest. So this is called that intermittent claudication. There's also numbness or weakness in the legs. You have slower healing of wounds in the legs, formation of ulcers, typically in the feet, especially if you've like stepped on something and you don't realize that you've stepped on something. And then there's typically also swelling and edema. So that kind of fluid retention in the bottom of the leg. Cool. That's all I had to cover in terms of the education side of things. Do you guys have any questions?
We lost you for a little while.
Oh no.
Not quite sure why, but you got as far as FAS.
Yes.
So it was face, arms, speech. What was T?
T was time.
Time.
Yeah, so just trying to get help as quick as possible. So calling 000 immediately. Because I said a little bit earlier, the faster they can get treatment or help, hopefully the better their prognosis, or the less severe their outcome is at the end. Yeah.
I did hear it was a 4 hour gap. If you needed to get a particular injection, and not all hospitals have a dedicated stroke area.
Yeah.
Is that right?
Possibly. I'm not 100% sure in that, because we don't really go through, that's more the paramedic side of things. Could be possible, but I suppose that's why, if you know this FACE acronym, you know what you're looking out for. When you call 000, you're able to tell them, okay, they have this, so their face is drooping, they can't use one of their arms, their speech is really slurry. They know that this is most likely going to be in the lines of a stroke or a heart attack, and that they're going to send the appropriate team to kind of cater for that. Yeah. So the more that you know, that you can identify, that's going to help the paramedics know like who to send. Because you're probably right, they probably have specific teams that are better equipped for certain jobs.
Yes. I think they do.
Yeah, so if you can give them
certain ambulances
yeah, exactly. So if you can give them those kind of key things, they can put their best kind of knowledge or their best guess towards what that person's experiencing, and then send the right team.
Thank you.
Thank you.
No worries. Did you guys hear about peripheral vascular disease?
Peripheral?
No, I don't think we did.
No. So that was just the last one of the three main cardiovascular diseases that are probably the most prevalent. And the peripheral vascular disease is just the blockage of blood supply in the arteries to the limbs. So the other ones are more towards the heart and the brain. Peripheral vascular disease is the ones going to the limbs. So mostly it's the legs. So usually there's a dull or cramping pain that's usually made worse when someone's walking, but gets better when they rest. So that's also known as intermittent claudication. So there's increased blockage. So when we do exercise, our blood usually pumps to those working muscles. But if there's a blockage, so if someone has peripheral vascular disease, that blood isn't getting to those working muscles. And that's usually why there's that increase in pain if they have this disease compared to when they're resting, and there's not needed, that extra blood isn't needed to go to those extra, those working muscles. So then, yeah, in line with that, there's usually numbness or weakness and slower healing times for wounds in the legs. The formation of ulcers, so that's typically in the feet. So usually, because that's the first thing that they lose that sensation to. So they might step on something or kick their foot against something and not realize that there's a wound there. And that's when it gets to, turns into that ulcer. And then the last thing that is one of the symptoms is swelling. So edema, which is that fluid retention in the bottom of the leg, just because there's no, not adequate blood flow of circulation to that part of the limb.
Thank you.
Thank you.
No worries, all good. I'm happy to email this out again if you guys received that last time. If you want it, you can maybe, yeah, stick up the information on the fridge, in particular about the FAST acronym. If you don't already have something like that, it's just a nice little reminder if it ever happens, hopefully not. So let's get into some exercise then. So we'll just need our usual equipment. So the chair, potentially the wall, dumbbells, and your TheraBand. How are you going, Colin? Are you up on your feet yet?
Not really.
Not really. So I'll be doing it on seated today.
Okay, but you can do something standing if we're not doing too much like bending.
Some things I can. Yeah.
Yeah. All right, cool. So same as last time. All right, well, let's do our warm up. So fairly normal warm up, and then we're moving into our circuits again. So how's everyone been going with the circuits? Or I don't know what you guys did in the last session. But so we're going to go through our circuits again where we work for 30 seconds, have our 30 seconds rest, and we'll keep moving through a few rounds of that. So trying to get our heart rate up where possible.
I can stand for some of it.
Yeah, so I'll just let you know, Colin, where you may or may not want another option. So you just let me know what you feel comfortable doing and what you don't.
Thank you.
Oh, no worries. So everyone up to standing just for a few warm-up exercises. So let's start with our breathe in and reach. So nice deep breath. You want to try and fill your diaphragm. So that's expanding your rib cage. So when you breathe in, you want to try and stretch your rib cage out. That takes pressure off our lower spine. And we can reach up feeling as light as possible and get as much stretch to our spine as possible. And then exhale coming down. So don't hold it too long. I'm talking the whole time, so I'm not really doing the breath work properly. And then once you get to the top, you feel like you can't hold it anymore. Exhale coming down. Good. Let's do 2 more here. Last one. All right, we're going to build on this now. And we're going to go into a calf raise. So that's just going up onto your toes. So as you breathe in, you're going to reach up to the roof, and then you're going to lift your heels and come up onto your toes a little bit. And then exhale, you're going to come back down and lower your calves down onto the ground, or your heels down, sorry. Keep doing that. On your toe, you might feel a little more unbalanced. Just try and do it nice and slow. Couple more. And last one. Good. All right, while we're standing, let's try and keep our hips still and try and get that rotation through our upper back. So hips and lower legs shouldn't be moving. Just trying to twist through that upper spine. If it helps, you can lean your bum against the wall. That will give you a little bit of feedback to see whether your hips are lifting off the wall, or whether you're able to keep them still or not. All right, nice, just resting there. Let's go arms out by your side. Make sure wrists are lower than your shoulders. Good, and we're going for little circles. And relax your shoulders, so keep them down away from your ears. And then reverse direction. Good, now let's make them bigger. And reverse direction. Good, and relax. Good, a couple of shoulder rolls. Relax your shoulders. Let's go hands on hips. We're going to try a couple of hip circles. So I feel like, Colin, you'll be okay doing this, but you're just trying to create a big circle with your hips. So we're trying to get that rotation. So you'll stick your hips back, bring them forward, around in a circle. Yeah. And try and make it as smooth as possible. And not so much movement with your upper body. Good, and then reverse direction. Hips back, bring them around, shoot your hips forward. So it's kind of like you're tracing the hula hoop if you're standing in the center of it. You're trying to bring your hips forward to the front of the hula hoop, slide your hips around to the edge and back forward. Good, just a couple more. And last one. Perfect. All right, let's go for some heel taps. So just stepping forward, lifting your toes so that your heel touches the ground. Good. Perfect, almost there. 3, 2, 1, and let's just go into a gentle walk. So just alternating feet, shifting weight from side to side. Good, 3, 2, 1, and let's go into a split stance. So 1 foot forward, 1 foot a little bit back. We're going to bring our fists up and do some of our shadow boxing. Let's warm up our abs a little bit. So when we're in this position, I want you to try and think about tucking your ribs underneath, kind of tucking your ribs in so they're not sticking out, your back is arching. So trying to draw them in, tuck your hips underneath you as well, and let's try and go for our boxing punches. So we've got weight predominantly on our front foot. That back foot taking a little bit as well. Getting a little bit of twist through your trunk only, so not at your hips or your knees, but only at your trunk. 3, 2, 1, and swapping sides. So bringing that other foot in front. So now we've got most of our weight in our other foot. That back foot taking a little bit, and let's go for some other punches. Three, 2, 1, and relax. Shake out your arms, shake out your legs. Grab a sip of water if you need. We might move into our circuits now, so we have plenty of time to get through them. So our first one here is going to be alternating lunges. So Sabina, for you, you're going to be taking a step forward, lowering that back knee up and down, stepping back together, and then doing it on the other side. So it'll be continually alternating, and you want to try and do them at some pace. Good. For you, Colin, let's try and do seated. Let's do the one you did last time first, where you're seated. You'll have your dumbbells in your hands held up at your shoulders. So Sabina, you can have a little rest at the moment because we haven't quite started yet.
That's okay.
So Colin, you'll be holding your dumbbells up at your shoulders. You'll be pushing up, but when you do, you want to try and lift one leg off the ground.
Okay. All right.
Yeah. So try to sit back on your sit bones. Make sure your tummy's strong so you're not flexing through the back. Up, one leg will come up, down, and then swap sides.
Okay.
Okay. I don't know when Beatrice will arrive again, but she can just jump in. All right, so we're going to do 30 seconds from here. So when everyone's ready, we will go now. So try and have some pace about it so that the rate is starting to rise for heart rate. Three, two, one, and relax. Good. We have 30 seconds rest, and we're going to go for another round. So we're just going to, for ease, just keep the same exercise. Do all rounds, and then we'll move on. Good, almost there. All right, 5 seconds, and then we're going to repeat. 3, 2, 1, let's go. So into your same exercise you were just doing.
There was a.
So we're just doing an alternating lunge. So just stepping forward, bending down, stepping back together, and then leading with your opposite leg, bending down, coming back. So just swapping sides every time. Trying to do them almost at a more increased pace than what we would normally do it, trying to raise our heart rate. 3, 2, 1, and relax. Good. 30 seconds rest. We'll go one more time.
Bring that today. That's the time that looks.
Good, and almost ready. 3, 2, 1. Let's go into our last round.
I don't know why this keeps on going to iPad.
5 seconds left. 3, 2, 1, and rest. Good. 30 seconds rest. We're going to be moving into our new exercise now. So for the ladies, you'll be either jogging on the spot or just walking. Whatever you think is going to get your heart rate up. For you, Colin, we're going to do boxing. So grab your dumbbells. Hold them out in front of your chest, and you're just going to do punches. So you can change whether it's just jabs, uppercuts, hooks. So whenever we do walking or jogging, you'll do boxing. All right, let's go. So ladies, you're choosing a pace that's going to be suitable for you. And Colin, you'll be doing boxing. Good. 5, 4, 3, 2, 1, rest. 30 seconds rest, and then we're going to go again. Good, halfway. Feel free to grab a drink in any of these rest periods. 4, 3, 2, 1, and back into it. Go as fast as you can. Get the heart rate up. Good. Nice work, everyone. Halfway. 10 seconds. Keep moving your feet or your arms, whatever you're doing. 4, 3, 2, 1, and rest. Good. Last rest before our last round of this one. Grab a drink whenever you need. Three, 2, 1, and let's go. Last round. You're either jogging, walking, or boxing. Good. Use your arms as well. Nice deep breaths in through your nose, out through your mouth. Just try and keep that breath steady, even though our heart rate is increased. 10 seconds left. And rest. Good, nice deep breath. So, while you're resting, I'll show you next one. So, ladies, we're going to be doing a quick side step. Do you want to be in a little crouch position as you're stepping side to side? Good. Colin, for you, let's get you doing so let's get you doing your push-ups with your band. Or actually, you can do it with your band or against the wall. It's up to you. So you can push using the band here, or if you want to stand up and do against the wall, that's fine as well. Up, whatever you feel comfortable doing. But you can change it every time. All right, when we're ready, guys, so we're going to be doing side stepping for the ladies or pushing from the chest for Colin. All right, let's go. Good. So if you can do it nice and fast, that's excellent. Try and keep your hips over your knees and ankles. So move your whole body with your step. 5, 4, 3, 2, 1, and rest. Colin, do you want to try doing the wall push-ups this round?
Yeah, all right.
I think you did them last time, so I think they should be fine.
Yep.
Unless you had any problems afterwards.
No.
I just think it's going to be a little bit more difficult for you, so better work out.
Gee, thanks.
Good. All right. 4 seconds left. 2, 1, and let's go again. Ladies, with the side step, Colin with your push-ups. Good. Try and stay nice and light on your feet. So push off your toes, swing your legs under. 5 seconds left. 3, 2, 1, and rest. We have one more round. Have a little breather. Grab a sip of water if you need. Halfway. throughout rest. 5, 4, 3, 2, 1, and let's go. Ladies with the side step, Colin with your push-ups. Last round, 30 seconds, give it everything you can. Nice deep breath. Remember, move your whole body along with your leg. Trying to get as many steps as you can or as many push-ups as you can in your workout. 3, 2, 1, and rest. Good, 30 seconds rest. All right, I feel like everyone will be able to do this next one. I'll show you what it is. Oh, actually, sorry. Our next one is back to our walking, jogging. And then Colin, you'll be doing boxing. So Colin, grab your dumbbells. You've got 5 seconds.
Okay.
And then ladies, let's go into our jogging or walking, and Colin into his boxing. Nice steady breaths in through your nose, out through your mouth. Use your arms as well. 10 seconds. And rest. Good. Nice little breather. Grab a drink of water if you need. Got 2 more rounds there of that one. Is there anyone starting to feel a little bit more puffy?
Yes.
Yeah.
Good. Okay. If you need to take any extra breaks, you can. Just try and jump back in whenever you feel ready. 5 seconds left into our second round. 2, 1, and let's go. Good. Nice work, everyone. Nice big breaths. 5 seconds left. And rest. Good. A little breather. We've got 1 more round of that one. Good. 10 seconds left. So after we finish this round, we'll all need to grab our dumbbells and I'll show you how to do the next one. And let's go. So last round of this one. Halfway. Try and keep moving. It doesn't matter if you slow down. Just keep moving. 5 seconds. 4, 3, 2, 1, and rest. Good. So 30 seconds rest, but I will show you what we're doing next. Colin, you'll be able to do this one as well. So it's a bent over row. So we just need to have that little bend in our knees, but more of a bend at our hips. Our dumbbells are in our hands. So we're going to row, we're going to pull up, then we're going to try and straighten our arms down and up. So you need to really make sure you're bent over, drawing your tummy in so that you can row up, do a tricep extension, bend your elbows back and down. Any questions about that one?
No.
You'll be able to do that standing, Colin?
Yes.
Yeah, cool. All right, we're going to move into that for 30 seconds. Then we'll have a rest. So everyone set up. And let's go. Rolling up to your chest. Straighten your hands out. Or arms. Bend your elbow again and down. So roll up to chest. Straighten your arm. Bend your arm. Back down. Nice deep breaths, drawing in your belly buttons to your spine so we're not arching or bending through our back. Good, 3, 2, 1, and rest. Good. Standing up, having a little rest, sitting down. Hold on to your dumbbells or put them down, up to you. Was that okay for everybody?
Yes.
Yeah?
That's fine.
So 10 more seconds and we're going to go again. 3, 2, 1, and go.
No.
Mhm.
With the flick.
Oh, sorry. Have my head down.
Sink your weight into the heels of your feet. Stick your bum back. You're all in your own homes. No one's going to be looking. Three, 2, 1, and rest. Good. Shake it out. Have a drink of water if you need. We've got one more round.
How you going with that one?
Yes, not too bad.
15 seconds left. Three, 2, 1. Let's go again. Try and keep that bend forward. Tummy's into spine. Keep a strong trunk. You want to look down, not fully down to the ground, but a little bit out in front so that your neck is in a nice neutral position. 4, 3, 2, 1, and up. Good. All right, 30 seconds rest. We will be going into another round of our jog walk. Whatever you choose, and Colin, you'll be doing your boxing.
Are we doing my what?
If you want to make it a little bit harder, ladies, you can do your jog walk while holding your dumbbells, if you choose to. Otherwise, you can do it as normal as what we've been doing before. All right, 4 seconds. 3, 2, 1, and let's go. Ladies, into your jog walk. Colin, into your boxing, if you want, or you can do walking too.
Probably shouldn't give that knee too hard workout.
No, no, not.
Good, 10 seconds, and we'll have a rest. And relax. Good, little breather. Grab a drink if you need. Wipe your brow if you're starting to get sweaty. $15 seconds and we're going again. 5, 4, 3, 2, 1, and back into your chosen movement. Jogging with dumbbells, walking with dumbbells, or without, and boxing with dumbbells. Halfway. Three, 2, 1, and relax. Good. Resting. Got one more round of this one. $10 seconds and we go for our last round. 4, 3, 2, 1, and let's pick it up again. It's the last one of this particular exercise, so give it all you've got if you can. You have one more other exercise to do so. 10 seconds left of this one. Just keep moving if you can. 2, 1, and rest. Perfect. All right. Ladies, you will be needing your dumbbells. You've got rest now, but you will be holding your dumbbells at your shoulders. You'll be doing a little squat, pushing the weights up above your head, bringing them back to your shoulders, going down for your squat and push again. That's what you'll be doing. Colin, you're going to be doing your crunches, seated crunches. So we're going to be working your abs. You're going to be seated. Try and have your hands up by your head, not putting any pressure on your neck, but you're going to try and bring opposite knee to opposite elbow. Try and go for your seated crunch. All right?
Okay, yep.
Perfect. All right. This is our last exercise and we'll do some stretches. So we'll do 3 rounds of these and then we'll cool down. All right, let's go. Weights, squat and press, ladies. And press. Bring them back to your shoulders. So then once you get that rhythm, you can start to move that little bit faster. Try to draw in the tummies, keep your spine strong. Exhale as you push out. Inhale as you come back down. 3, 2, 1, and rest. Is that okay, Colin?
Yes, thank you. Yeah.
And ladies, you're good with that one?
Yep.
Yep.
Thank you.
You're good.
Yes.
All right, it's just 2 rounds left. 10 seconds of rest. 3, 2, 1. Ladies holding the dumbbells. And let's go, everybody. Colin, as you try and touch your knee to your elbow, exhale, push all the air out.
Trying.
Inhale when you open your body. Exhale, try and get those 2 limbs to touch.
Quite so fast, I suspect. Quite so fast, I suspect.
4 seconds, 3, 2, 1, and rest. All right, last rest, we got our last round. You guys hanging in there?
Yep.
Everyone's faces, arms, speech, all good? Good, all right, 5 seconds. 4, 3, 2, 1, and let's go. Ladies with our squat and press. Colin with your seated crunches. Good, last 10 seconds. Get in as many as you can. 5, 4, 3, 2, 1, and relax. Whew. Little breather. Put down your dumbbells. Have a quick drink if you need. We're going to do a couple of stretches and then we're done. Good. So let's start with our triceps because we just did. We'll start upper body and work our way down. Give yourself a pat on the back here. Bring your other hand over the top and try and pull it back to get that muscle group here. Try and relax your shoulders, relax into the stretch. Good. One more deep breath. And slowly let it out, so don't just drop your arm, and then going to the other side. Doing the same thing. Nice deep breath. And relax. All right, shake your arms. Let's bring the other one across the body. Hook it underneath. Okay, itching your eyes optional. Good. And relaxing that one nice and slow. Don't just drop it. Bringing it over. Good, and relax. Good. Shake out the shoulders. Do a couple of rolls. Do a couple of our twists like we did in our warm-up. Just let the spine know we're done. That still needs to be there for us for the rest of the day. Good. All right, relax there. Well, let's do a calf stretch. So we did a bit on our calves. So finding an object just that's sturdy to push against, getting that 1 foot back, 1 foot forward just to support our weight. And we're going for a stretch in that calf in the back leg. The leg you're trying to push your heel down to the ground in. Good, and swapping sides. Good, and coming out of that one. All right, nice deep breath. Give yourself a pat on the back. We are all done. Hopefully feeling a little bit fitter.
Yes.
Good. Any questions about today or feedback or anything there?
No, it's good. Good work.
Well, I'll flick you out the information that I went through today, just so you can have another read through it in case I glitched or you just want to read over it again. I'll flick it out. Otherwise, I will see you all next time I'm here.
Okay, fantastic.
Thank you very much.
Week.
Perfect.
Thank you.
Yeah. Have
Bye.
an Easter
Bye.
weekend, guys.
Yeah, thank you, and you. Bye-bye.
Bye.
Bye.